So when I started working as a nurse, I thought I was going to have an easy time working night shifts because everyone would be sleeping. But then I found out this. So meningitis is inflammation of the meninges. The meninges are a protective layer that cover the brain. This inflammation usually happens because of a viral or bacterial infection. Usually that comes from an upper respiratory infection, so it travels up to the meninges. There's also a small chance that this can happen because of a basilar skull fracture. The bacteria or virus can go from the fracture of the skull into the meninges and cause the inflammation. This is known as post-traumatic meningitis. The people at highest risk for meningitis is going to be teens and young adults. This is because teens and young adults tend to be students. This is especially true for dorming college students who are living in really compact spaces. How we go about preventing this is through immunization. Now, when these patients come in, they're initially going to complain of a really severe headache, a high fever, and nuchorigidity, which means stiff neck. The patient can also have something called a positive Brzezinski's, and that looks like this. When you lift the patient's head up, their legs are going to come in and it's going to cause pain. The next sign is a positive Kernick sign, and it looks like this. And what you do is you bend the leg at 90 degrees and then you lift it up. What's going to happen is their head is going to come up and they're going to have pain. The patient can also have decreased level of consciousness. Level of consciousness is essentially how aware the patient is. And when they have decreased level of consciousness, they'll have lethargy, confusion, and agitation. The last few symptoms include photophobia, which means they can't be in the sun, a rash, and seizures. Something interesting about the rash is that it doesn't blanch. So when you press on it with glass, you'll still be able to see the rash. Alright, so when a patient presents with these symptoms, we're going to do a couple diagnostics. Initially, we're going to get a CT or MRI done to see if there's an inflammation or to see if there's masses in the brain. We also want to get a lumbar puncture, and this is to collect CSF, cerebrospinal fluid, so it can be analyzed so we can know what type of meningitis it is. Let's talk a little bit about the procedure for lumbar puncture. So before the procedure, you want to make sure the patient has an empty bladder. This is to prevent discomfort. During the procedure, it's your job to position the patient in lateral or side-lying position. I like to think of this as positioning the patient like a shrimp. You can also put them sitting down, leaning forward over something. After the procedure, you want to make sure you position the patient flat on their back. This is to prevent cerebrospinal fluid leakage, which can cause headaches. If the patient ends up getting a headache, you want to give them acetaminophen. If the dressing on their back becomes saturated in CSF, then you want to notify the provider. The last thing, and really the most important thing you need to know about lumbar punctures, is the contraindication. We never ever do lumbar punctures on someone that has increased intracranial pressure. We'll talk more about increased intracranial pressure at a later time. It basically means the pressure in the brain is up. Alright, so now we get our CSF back and we need to know what it means. If it comes back cloudy, it means there's a possible bacterial infection. We'll also see increase in WBCs, increase in proteins, and a decrease in glucose. Remember, this is specific to bacterial meningitis, which is the severe form of meningitis. Viral meningitis has different CSF analysis, and it's not as severe. Alright, so we confirmed that the patient has bacterial meningitis. Now, what do we want to do for this patient? The first thing you want to do is initiate droplet precautions. This is to prevent infection to others and to yourselves. So make sure you wear surgical masks. The next thing you want to do is the cultures. So you want to do the lumbar puncture. For viral meningitis, you would do the swab, and you want to get blood cultures as well. The third thing you do is administer antibiotics. Antibiotics is what's going to treat this patient and to get them better. And the last thing you want to do is give medications that reduce the fever, like acetaminophen. Make sure you follow this order. Think about it. You wouldn't go in a room without the proper PPE and administer medications. And you wouldn't administer antibiotics before you got the cultures first. So make sure you follow the order. The other nursing interventions include seizure precautions, which means you pad the side rails, positioning them semi-folars and preventing them from bending, and reducing the stimulation in the environment, like dimming the lights. All of this is done to reduce the intracranial pressure that the patient might have. Alright, now the medical treatment. Now, I know I said give antibiotics, but really what we want to do is give the steroids first. This is to reduce the inflammation and reduce the pressure in the brain. And the steroid we want to give is dexamethasone. Look how it ends in SONE. Almost all steroids end in SONE. Now, the side effects of corticosteroids include increase in weight, risk for infection, which means the patient can get sick very easily because of the decreased inflammatory response. The last side effect is stomach ulcers and GI bleed, so make sure the patient takes this in the morning with food. You also never want to stop steroids abruptly because it can cause a really severe thing called Addisonian crisis. And you want to teach the patient to avoid crowds and sick people. Alright, let's talk about the antibiotics. There's 2 rules to antibiotic therapy. The first one is that you make sure the patient completes the entire course of antibiotics. Otherwise, the bacteria can build resistance to them. The next is that if a patient's on antibiotics for a long time, they can get something called C. diff, which is really watery diarrhea. The first one's going to be vancomycin. This is a really strong antibiotic, and it has a couple side effects. The first one is going to be red man syndrome. The patient starts turning red. They can also get nausea and dizziness. These symptoms can even get really severe and their blood pressure can even drop. Now, what you want to do for this patient is you want to stop the infusion. You want to administer diphenhydramine, the brand name is Benadryl, and then you want to restart the infusion at a slower rate. The next side effect for vanco is nephrotoxicity, which means it damages the kidneys. So you got to make sure the patient has good kidney function. There's 2 labs that let us know about the patient's kidney function. This is BUN and creatinine. BUN and creatinine are byproducts that the kidneys normally get rid of. Normal levels for creatinine is a 1, and normal level for BUN is 10 to 20. When these levels are elevated, it means the kidneys aren't working well. Make sure to hold the vancomycin if the patient has elevated BUN and creatinine. Next is ototoxicity, which is damage to the ear. The patient will complain of something called tinnitus, which means ringing in the ears. Now, one of the most important jobs you have is to draw peaks and troughs. Peak and trough is essentially the concentration of drug in the body. Peak is the highest concentration of drug in the body, and trough is the lowest concentration of drug in the body. You want to draw peaks 30 minutes to 1 hour after you have administered the vancomycin. So once the vanco is done, then 30 minutes after, you want to draw it. The trough, you want to draw the blood right before you hang the next bag of vanco. The next antibiotic is called ampicillin. Look how it ends in -cillin. This is a type of penicillin. The side effect for this is rash. And make sure you know that penicillins interfere with estrogen-based contraceptives, so oral contraceptives. So tell the patient they have to be on another form of contraceptives. The next class of antibiotics is called cephalosporins. So the drug of choice here is ceftriaxone. Look how it starts with CEF, sometimes CEPH. The side effect for this is that it has a cross sensitivity to penicillins. So if a patient has a penicillin allergy, they may also have a cephalosporin allergy. But this doesn't apply to ceftriaxone, but it does apply to cephalexin, cephalothin, cefadroxil, and cefazolin. Alright, the last drug for meningitis is acetaminophen, an antipyretic to reduce the fever. The side effect for this is hepatotoxicity, so it damages the liver. Make sure you only give 4,000 milligrams a day. And to check the LFTs, liver function test. These tell us how well the liver is doing. This includes ALT and AST. If these are elevated, make sure you do not give the acetaminophen. That's everything you need for meningitis.